Imagine being in the moment with your girl. Everything's going right, the vibe is right, everything feels good, but your erection doesn't show up. Your body switched gears even before you realized it. For a lot of men, that's the reality of unreliable erections. They're unpredictable, unreliable, but the most important thing is there's nothing to be ashamed of. Hi, my name is Sylvia. I'm a sex and relationship therapist, and I help clients with everything that's going on outside of the bedroom that could be affecting them inside of the bedroom, helping them to create not only the sexy life they want, but the sexy life they deserve. And if you or your man are going through unreliable erections, follow for more. Because not only are they common, human, but there's also nothing to be embarrassed about.
Now, a quick explanation as to why I call them unreliable erections as opposed to erectile dysfunction. Because most men that I work with don't have a dysfunction. Their body is working, but just not consistently in the moments that they want it to. The word dysfunction can make a man feel broken, defective, or less of a man. And that shame alone can make the problem feel worse. Unreliable is more fitting. It means your erections do work, just not every time and under certain conditions. And now that I've made that clear, we can actually talk about what could be going on and not what shame tries to label you with.
Now, I have a lot of male clients that have been living with unreliable erections, and the first thing I do when I have clients like this is I recommend that they go to the doctors to ensure there's nothing medically going on. That's your blood pressure, your blood sugar, cholesterol levels, any underlying medical issues can all be having an impact on your unreliable erections. Conditions like diabetes, heart disease, and even antidepressants can affect erections, so we get that all checked out first. And here's something that some people don't realize. If your erections are absolutely on point when it comes to your solo play, and also if you have morning and evening erections, that means your body's working. So if your erections are unreliable when it comes to partnered play, it's usually situational and not medical. However, some men do experience changes both in solo play as well as in partnered play, as well as when their erections show up naturally. That's morning and nocturnal. And that's when we have to look deeper into the medical side of things. We also explored the difference between your mind being switched on and your body being ready. Those two things don't always show up together. That's a mismatch. It's called non-concordance, and it's perfectly normal. Most erection concerns aren't about attraction or capability. They're about the conditions around the moment. So here's 10 things you start to discover about unreliable erections when you come to sex therapy. And trust me, you're going to want to stay around for all of them. I can't even say stay around for the last one. Just stay around for all of them, okay? You learn how one soft moment can leave an imprint on your sexual life. Now, I have a lot of clients that have come to me with unreliable erections, and when we go into the consultation side of things and finding out when it first started, some of them have mentioned that they have been spoken to in a certain way that has stayed with them, or they've been berated, or something has been said about their performance that has stuck with them. This then becomes the imprint, and this is what sticks in their mind just before they're about to be intimate again. Even if in their mind they feel like they're ready, your brain will go straight back to that memory. You realize the fear of it happening again is louder than the situation you're currently in. You take away your sense of masculinity from what your penis does. A lot of my clients feel like they're less of a man when it comes to having unreliable erections, and that is putting on the lenses of society when it comes to the situation they find themselves in. In therapy, you start to learn how cultural and societal lenses shaped your beliefs, and just how outdated they actually are. You start to notice the subtle habits that get in the way of you achieving an erection. Holding your breath, going into your head, trying to stay in control, checking in to see if you're doing well, and even the pace in which you're going. All these little habits interrupt arousal without you even noticing. You start to recognize and understand why your penis works absolutely fine when you're alone. When you're alone with your penis, there is no judgment, there's no expectations, and there's simply no pressure. With a partner, your mind becomes more alert, more aware, and even more self-conscious. And that can change your body's entire response. You learn how emotional tension can actually show up in your erections too. If you're arguing with your partner, if there's any resentment, if there's any emotional distance, or you simply feel unheard, Your body holds all of that. You start to learn that you can't jump from tension into intimacy. Your body also needs emotional safety too. You discover how your pelvic floor tension affects everything. An anxious, tight pelvic floor blocks the blood flow. Most clients don't realize how tense or clenched their pelvic floor is until they're guided through releasing it. You finally understand your accelerators and your inhibitors. What turns you on, what doesn't turn you on. Your preferred touch, pace, tone, connection, environment, stress, body worries. You learn your exact blueprint and stop guessing. You realize that your lifestyle plays a much bigger role than you thought. Your erections is directly linked to your cardiovascular system. Stress, hydration, alcohol, smoking, sleep deprivation. Your body tells the truth even before you've recognized it. You realize that intimacy isn't just based on one body part. When you stop making your erection proof of connection, everything opens up. Sensuality, touch, curiosity, and play. And what's so ironic is erections tend to be more reliable when they're not the main character. Okay, I'm feeling generous, so I'm going to give you 2 more. You start to recognize how porn has been training your arousal. Porn teaches your body how to react instantly. You're in control of everything when it comes to watching porn. The pace, the angle, and the fantasy. 0 nerves, 0 pauses, and 0 pressure. You start to realize that in partnered play, there's emotions, there's unpredictability, and there's also closeness. And your body needs time to adjust. You start to recognize why it is your body acts differently when you're with a partner versus when you're alone. This isn't about dysfunction, it's about recalibration. Sex therapy helps you recognize that you're not inconsistent. Your body's reacting to 2 completely different environments. And this is the last one. It might be a hard pill to swallow, but it has to be swallowed anyway. You start to recognize how your solo play could be affecting your partnered play. A lot of my clients didn't recognize that the timing of their solo play can also affect how they've been showing up in their partnered play. It does really make a big difference. If it's too close to partnered play, it can reduce your sensitivity, delay your erections, drain your arousal, and actually make your body expect porn-like situations instead of real connection. Sex therapy will teach you how to space out your solo play, use it more intentionally, and support your partnered experiences rather than interrupt them. You're not going to be told to stop. You're shown how to use it in a way that works for your body. And let me just give you another one, because why not? The biggest thing you learn in sex therapy when it comes to unreliable erections is your erection was never the problem. It wasn't ever about your penis. It was about the atmosphere, the pace, the fear, the overthink, and the emotional climate in which you found yourself in. And once all those pieces are shifted, your body starts to respond in ways that tension never allowed. And that is how you start to create not only the sexy life you want, but the sexy life you deserve.